Hello, good morning. Welcome to the Sunday Show. I'm Martin Geissler. We're looking at healthcare this morning. 7 years after the Scottish Government drew up a plan to sort out general practice, the pressure on our GPs has increased, the number of full-time GPs has fallen, and it's harder than ever these days to get an appointment. So how on earth did it all go so wrong? The GP, Dr. Siggy Joseph, is warning the situation is so bad we could see the collapse of general practice in Scotland. What might that mean? She's going to join me in just a minute to discuss. After that, we'll speak to the man who has to try and find a cure for all this, Scotland's Health Secretary Neil Gray. And Scottish Labour's Deputy Leader and Health Spokesperson Jackie Bailey will join me too. What does she think needs to be done? We'll ask her. Oh, and in case there was any doubt that the whole country's in a bit of a pickle at the moment, Rachel Reeves laid it all out in her spring statement this week. I will, of course, ask our politicians for their take on what she had to say. After that, it's over to Andrew Black on the radio and on BBC Sounds. Morning, Andrew.
Morning, Martin. We're talking NHS as well. We're going to be finding out what the country's nurses make of what Neil Gray has to say to you. Also on the programme, we're going to be finding out how women might be impacted after those spending plans announced by the Chancellor this week. And Glasgow's Comedy Festival is coming to its end. We're going to look at who's up for the coveted Billy Connolly Spirit Award.
All right, Andrew, thanks very much indeed for that. More from Andrew on the radio at 10:30. Let's get on with the show. Yeah, loads to discuss this morning. If you want to be part of the whole conversation, get in touch on social media. It's the usual hashtag BBC Sunday Show. Now then, back in 2018, the Scottish Government agreed a new contract with GPs. It was meant to take the pressure off them financially and in terms of their workload. It was also supposed to improve our chances of seeing a doctor. However, a report from the public spending watchdog Audit Scotland has found that the number of full-time GPs has actually fallen in that time. Pressure on general practice has gone up, and we all know how hard it is to get an appointment these days, don't we? So just how bad is the crisis in general practice here? Well, Dr. Siggy Joseph should know. She's been a GP for more than 20 years, and just this week she received an award from the Royal College of General Practitioners because she's trained more than 1,300 new GPs in that time. She joins me now from Edinburgh. Good morning to you.
Good morning, Martin.
Thanks very much indeed for being with us. So 1,300 GPs trained. Some of them at least must have asked you, what's it actually like to be a GP these days? What do you tell them?
It's increasingly difficult to stand up there and say that it's a fantastic job. The job has really changed in certainly the last 5 years. But really the relationship with the patient one-on-one is the best part of the job. Outside of that is the increasing pressures that we've been facing. Year on year, patient numbers per doctor has increased. We know that we've got less doctors than we did working in general practice than we were hoping for at this time, and certainly nearly 2% less than when the count first started. So if you add all that together, less workforce, increased demand, more complexity with our patients, increased waiting times at hospitals, it is becoming a very challenging job.
Why? What's gone wrong? What's at the root of all this?
Well, I think the writing's been on the wall for those in the front line for quite a number of years. We've been able to see that, we've got an ageing population, we've got rising health inequalities, but alongside of that, a lot of the budget that we maybe previously held, which was already falling short, has continued to decline, and there was even a 6% change since 2021 for the last financial year. So really, when primary care is the bedrock of all clinical contacts, really, we do 90% of clinical contacts in primary care. If we can properly scaffold it, we can keep people out of hospital. When we know our patients well, we can avoid unnecessary investigations and referrals. So continuity of care is really key here as well. So there's lots of different reasons, but I would say funding overall is the biggest reason that the job has been eroded for those on the front line.
Right, I mean, it's a reasonably complex way that a lot of GP practices are set up, isn't it? I mean, basically you run yourselves as a business and then you kind of effectively build a government for the treatment that you give. So it's just a lack of money, is it? You can't afford to hire new GPs into these practices because you just don't have the cash?
So you're right in that we run it as, most general practices are run as partnership models, and it's actually very financially effective for partnership models. We run very high quality. We always do quality control, efficient practice service. So when you've got practices that can no longer meet the needs of the community, those are the practices perhaps up north we see that a lot with some of the practices that have had to hand back to the health board because they no longer have the staff to meet the patient list size that they have. So then we know that the kind of running of those, the costs of running those practices are far more than the partnership model that we have protected for so long. So it's far more efficient to have GPs running a service because in this country, we've got a lot of variance in the postcode. So we know, for example, where my practice is, we're semi-rural. I know with my partners what will suit my practice population. So it's not one size fits all. And that's why when we get the funding, we need to be able to have the autonomy and the decision making and the services that we can use to then service my patients and my population.
Right. I mean, so you've trained 1,300 GPs. At the moment, there aren't jobs really for them because practices don't have the funds to create those positions unless, presumably, somebody leaves. What happens if this doesn't get sorted out?
Well, and that's the real risk. I mean, training is a real passion of mine, and we need to encourage our junior doctors and our junior GP trainees to stay in the profession, and really importantly, to stay in Scotland. So we're training a lot of GPs, but then because of lack of jobs and perhaps some visa issues, they're leaving straight away to other countries, which is really a double waste of resources. And so the reason that, particularly in certain parts of Scotland, there are financial uncertainties around lease issues, building service costs, and of course, the big issue about national insurance. The rest of the NHS is exempt. However, GP surgeries are facing these large bills. And if you trying to predict how to run your practice going forward, it's difficult to say, well, I'll take a break and put a locum in my place, or let's soak up some of this demand with putting in a salaried doctor, because we can't predict our future earnings and stability of the practice in terms of finance coming in.
Right. So, I mean, so you don't bring a locum in, so what, you just keep on working, which adds to the strain on you, and therefore people will leave the profession. I mean, what happens then if this doesn't get sorted out? What are we looking at?
Well, I think doctor burnout is a well-recognised issue, and I think in general practice we have, particularly in the mid-career doctors, I'm a mid-career doctor, so you know we're continuously trying to soak up more and more work, longer hours at work, and being unable to take that break. So I have colleagues in other surgeries that have cross-covered each other for many, many weeks and months, and that actually just leads to exhausted doctors, which more importantly is a risk for patient safety.
Right. I mean, you've talked about the collapse potentially of general practice in Scotland. That sounds pretty apocalyptic. What does that actually mean in real terms?
I would certainly hope we don't get to the collapse, and it will affect absolutely everyone if we got there. And I think there's a long way to go. There's a lot of, for example, the college, the BMA, the LMC, we all have lots of good, solid ideas on how we can actually work through this erosion that's taken place over the number of years. And we really welcome the government's commitment to increase primary care funding going forward. But really, we need to be really clear on what proportion of that is going to go directly to general practice. As I said, GPs know their patients very, very well. We can keep people out of hospital. That continuity of care is key to really good holistic health care.
Right. Well, the Health Secretary's coming up in just a second. We'll ask him about all of that. How urgent is this, Siggy?
I would say it was 5 years ago, and it's more and more pressing by the day. All around us, surgeries are having to hand back to the health board. We've seen practices having to adopt access systems which they don't particularly want to adopt as the clinicians, and there's almost a grieving sense that we're having to change the way that patients access us. And also we have patients in some practices doing the 8 a.m. phone call or even e-triage, which really, if you you know, it actually is very difficult for lots of patients to navigate that system, particularly electronic triage. You might not have a computer, and the calling every day at 8 a.m. for a GP appointment is extremely challenging for anyone at work, or really just for anyone.
All right. Siggy Joseph, we're going to leave it there. Thank you very much indeed for being with us on the Sunday show this morning. Well, as discussed, Scotland's Health Secretary Neil Gray was, I hope, listening to that. Let's find out what he thinks. Good morning to you. Welcome to the Sunday show, Mr. Gray.
Good morning.
How concerned are you listening to that fairly bleak assessment of the state of general practice?
I recognise the challenge, and I'm very grateful to Dr. Joseph for the work that she does and the work that all general practitioners and their staff do to serve the people of Scotland. We've substantially increased the funding over recent years that goes into primary care. General practice receives 1.3 billion through the budget this year, an increase of £73 million. But I recognise, as Dr. Joseph just outlined there, that the pressure that's coming as a result of the UK government's increase to employer national insurance contributions makes the financial picture uncertain. It was challenging before, I recognise that, and we've got more to do there, but this makes it very difficult indeed. And that's why we are looking with the BMA, with the Royal College and local medical committees, of whom I've all met in recent weeks, at what can be done over the coming period to provide that stability to general practice, and also look to engender the reform and improvement that I'm looking for, which will see a greater proportion of our funding, but also the level of treatment happening in general practice and primary care. I want to shift the balance of care away from our hospitals and into the community, so people can get access to the health service on their doorstep in a much easier way.
OK, I mean, you're apportioning a substantial amount of blame, I think, on the Labour government for the national insurance increase, which hasn't come into effect yet and is a very recent part of this problem. Actually, Siggy Joseph is saying this problem goes back 7 years. And at the moment, you seem to be in breach of, your government seems to be in breach of the contract that it signed back then. You're miles off target to meet the promises that you made. How much money can they expect in terms of, increased funding? Siggy Joseph there was saying what proportion of the increase that's going into primary care will go to GPs? Can you tell her that?
So going back to the point that you've just made, I don't apportion the entirety of the blame to the UK government's increase to national insurance contributions. But that is providing a great level of anxiety amongst general practice as to how they're going to be able to employ staff. I recognise, and as I did in the answer previously, that there is challenge and has been challenged financially prior to that. But this is loading on top of that. And I would argue that the UK government should be resolving that at source and exempting all that are providing public services. That was a ridiculous option to raise finance.
Okay.
It's decimating economic growth. But going back to your point around the implementation of the contract, we have substantially increased multidisciplinary staff, nearly 5,000 wider staff that are employed both by health boards and directly by general practitioners.
We've got 67 fewer full-time GPs than we did when you signed that contract, and your ambition was to increase the number by 800.
No, that's not true, Martin. We've seen the headcount number of GPs increase by 300, more than 300.
What did Scotland say you have 67 fewer full-time GPs?
No, we have headcount more than 300 additional. I recognise that post-COVID, as we've seen across various elements of the economy, people are choosing to take a better work-life balance, which I think is the right thing for people to do. So I recognise that on a whole-time equivalent basis, there is a narrowing of that position. We want to increase that. We've got a record number of GPs in training. Dr. Joseph is providing an incredible service supporting that position. I want to make sure that we attract. I want to make sure that we attract and retain staff. We published an attraction and retention plan that the Royal College of GPs welcomed in November, and we are also seeking to publish later this year a plan to reform primary care in its entirety, because we recognise general practice is obviously central to the health service, to primary care, but we want to make sure that pharmacy, that community optometry and various other elements of primary care are supported, as I say, to shift the balance of care away from our hospitals and into the community.
Yeah.
And that's what we're going to be endeavouring to do over the coming period.
So you're talking about a 15% increase in funding for primary care. What percentage, what proportion of that increase will go to GPs? Can you answer that question that Siggy Joseph very specifically asked?
So we will be publishing over the coming period how we are investing the money that's coming through the budget for 25-26. There is money there to improve operational flow through the system. I'll be publishing tomorrow an operational improvement plan, which is about getting waiting times down. It's about getting greater access to the likes of general practice, but other aspects of the health service as well. And critical to that is going to be reducing waiting times, because I recognise the challenge that there is in terms of increasing complexity of patients arriving at general practice and acute clinics, and the additional time that's required in order to treat them. But what is an additional problem is that because of the waiting times, either for diagnostics or for treatment, people are having to return to their general practice repeatedly in order to get support for the symptoms that they're presenting with.
Right.
We need to reduce those waiting times, and that's what this plan is all about delivering.
Okay, you promised back then to increase the number of GPs by 800 by 2027. You've got 2 years left to do it. Are you going to do that?
I recognise that that's a challenge, but we have increased by 300 already. We've got a record number of GPs in training, over 1,200 GPs in training at present. My priority, as Dr. Joseph outlined there, is to see them attracted, first of all, but also retained here in Scotland. And we published a plan, which again, I repeat, the Royal College of GPs welcomed in November, 20-point plan to retain those that have gone through training here in Scotland, And that's going to be my ambition, so that we can get towards that 800 figure.
Right. I mean, a lot of them are not staying here at the moment. They're going off to places like Australia, where they can get more money for not doing as much work and not face the burnout here. That is an alluring option for a lot of people. How do you counter that?
We need to counter that by implementing elements of the contract that haven't been implemented yet, and we're underway in discussions with the BMA on how we can bring forward the non-staff costs part of the contract.
Right.
We've already delivered in terms of a stabilisation in GP pay. We have come forward with elements of the contract that have been delivered on the multidisciplinary team, and taking elements of workload away, such as vaccines and other aspects that are delivered by CTAC staff.
Okay.
Now we need to move on to the next elements, and I'm committed to doing that.
Okay, last question on this. I think most people listening to or watching this will know the stress of the 8 a.m. phone call to desperately try and get an appointment. Why isn't there an app for this?
We're bringing forward an NHS app, the Digital Front Door. It's going to start in Lanarkshire later this year. I recognise that for too many there is that a situation where there is an 8 a.m. rush. That's not universal. We have to recognise that general practitioners are independent contractors, and they set up their own appointment system, and that is not universal. There are different ways of appointment systems being set up, but I recognise for too many that is the picture. And what we are bringing forward later this year is the start of a digitisation of people's records and their ability to access the health service digitally.
That sounds like something that should have been done years and years ago, doesn't it? Are we way behind the curve on this?
Well, I was actually hearing from in a round table with pharmaceutical colleagues that actually, from a digital perspective, we're not way behind. But I recognise there is more to do for us to catch up for some of those that are leading in terms of the digitisation of health services. That's what we've committed to through the budget that's being delivered at the moment. In December, we will see the start of the rollout of an NHS app, which will be not just about health service, but will also be about social care, bringing forward that real integration that we need between health and social care.
Okay, look, let me change tack just briefly while we've still got you. Are too many people in Scotland on benefits at the moment, do you think?
So I think the Chancellor made a big mistake in the spring statement, because she equated the personal independence payment, which is a disability payment, with out-of-work benefits. PIP is not there as an out-of-work benefit. It is to support the cost of disability. And so if you're looking to get more people into employment, it would serve you better to provide greater support for those that might be close enough to the labour market in order to access it.
Sure, I was just asking you broadly, though. My question was more general than that. Do you think too many people in Scotland are on welfare benefits?
Obviously, we want to make sure that we reduce economic inactivity, and where we can support people into employment. We've got incredible employability services here in Scotland. But the point that I'm making is that to equate personal independence payment or adult disability payment here in Scotland with an out-of-work benefit is an error. And I think that was the big mistake that the Chancellor made, was to seek to settle and balance the books on the backs of disabled people who are more likely to be in poverty, are more likely to be furthest from the labour market. You're better provide that support to them to enter the labour market rather than take it away.
Right, listen, if you want to keep the welfare system in Scotland the way it is just now, if you want to mitigate the cuts that are coming, you're going to have to find an extra £400 million. Do you know that yet, if your government's going to be able to do that?
Well, we already invest more than £1 billion more than we receive from Westminster to deliver social security in Scotland.
So can you afford to keep that up? Can you afford to mitigate this?
So we have to balance the books every year. Of course, we need to look at what this new wave of Labour austerity is going to mean, because that's what is being delivered. It's a new wave of Labour austerity.
Well, it's not, because public spending's actually going up over the term of this Parliament, so it doesn't fit within the definition of austerity, does it?
Sorry, Martin, tell that to disabled people.
No, it's a fact. It's the definition of austerity. Public spending is going to go up over the term of this Parliament, so it doesn't fit within the definition of austerity, does it?
We are tell that to disabled people, tell that to the WASPy women, tell that to the pensioners who've lost out on their winter fuel payments, also we are still to see what the cuts to departmental spending at Westminster is going to do to our block grant. We know that this year it's going to see a reduction in what we should have expected in terms of consequentials. When we consider the reduction, the increase in employer national insurance contributions, the real terms 1% increase that we're to receive to our budget is effectively wiped out. We are seeing a fiscal transfer from Scottish Public Services to the Treasury as a result of the increased employer national insurance contributions. It was the wrong choice, as is this new era of Labour austerity.
Neil Gray, Health Secretary, thanks very much indeed. We must leave it there. Thanks for being with us on the Sunday show this morning. Well, Dame Jackie Baillie is Scottish Labour's Deputy Leader and Health Spokesperson. Good morning to you.
Good morning.
Thank you very much indeed for being with us. We'll get to GPs in a minute. What do you think? Are too many Scots on benefit?
Well, I think we want as many people to be in work as possible. And it is the case now that there are 300,000 people in Scotland economically inactive. That's highest in proportional terms to the rest of the UK.
Why is that?
Some of them, well, when we have 1 in 6 people on hospital waiting lists for either diagnosis or treatment, then some of those are people who can't work because they need knee operations or hip operations. So they are either short-term sick leave or indeed some are long-term unavailable for work. So getting them back into work is what they want, but it's also good for the economy, because then you have more people paying taxes and contributing to the growth in the economy.
And that is your plan, so Rachel Reeves says. But when the OBR, when the Office for Budget Responsibility comes back to you and says, hey guys, listen to this, these plans of yours are going to push 250,000 people more into relative poverty, 50,000 children extra into relative poverty. Surely you, as the Labour Party, have to say, right, well, we need to change that plan, don't you?
Well, the two things I would say to you is, first, the OBR modelled the impact of the changes. What they didn't model was the impact of people going into employment. And that needs to be seen as the counterbalance to what's going on.
No, sure, but
none of these changes take place...
They're government figures, 50,000 children being pushed into relative poverty. It's a good plan, is it?
But what they don't do is measure the impact of these people going into employment. Now, I'm old enough to remember, when Labour was in government in Scotland, we lifted 200,000 children out of poverty. And the reason we did that was because we put people back to work. Their parents got back to work. And
the Scottish government's lifting children out of poverty by giving them benefits.
But the Scottish government, to be fair to it, is cutting employability programmes, is not actually assisting people get work. That's the key difference. The Scottish Child Payment is great. That makes a difference to people. But actually giving them the dignity, the financial independence of working has to be something that government does. We can't, if you look at the OBR, they're saying currently PIP accounts for in disability benefits about £50 billion each year. They're projecting in the next 5 years that will grow to to 75 billion.
So if you were
That's
an MP,
not sustainable.
If you were an MP, you would be supporting this all the way through Parliament, would you?
I support getting people into work.
You'd be supporting this bill. The Welsh Labour First Minister doesn't support it. You would support it, though, right?
I would support getting people into work. I think that is the right objective. Spending, an extra, well, £75 billion if we don't do anything about getting people back into work is the wrong approach. It's not sustainable.
Right.
Getting people back into work is key. None of these changes take place till November 2026. There is time to focus on an additional £1 billion going towards employment support, which, frankly, the SNP have cut.
Last one on this. I mean, it's all right. You're talking about time frames. It's all right for Rachel Reeves and Keir Starmer. They don't have to face the voters again for another 4.5 years almost. You do. You've got an election rattling down the tracks just over a year away. This stuff and a whole load of flagship policies that have preceded it in terms of taking money away from the needy don't help you in that regard, do they? Labour is in trouble now in Scotland because of Westminster Labour policies. Would you agree or disagree with that analysis?
I don't agree with you.
You think you're going to be fine at the election?
No. I think every election is a challenge and should test people. We are taking nothing for granted, but I have to say, when people look at 18 years of the SNP, look at their record, where we have huge waiting lists, delayed discharge at record levels, our children being failed by the education system, and the economy flatlining, people will want a different choice. And the only people that can beat the SNP, who are, frankly, tired, divided and out of ideas, is Scottish Labour.
But that was all right. That argument was all right until you took government. Now the SNP can say, you don't have to like us, you don't have to love us, you don't even have to support independence. But now we know what Labour do when they're in government. We've seen it and it hurts. And do you really want that? And it's going to be a persuasive argument to a lot of people, isn't it?
And we've seen what the SNP have done over 18 years. Do you know, if they had a good idea about how to restore our public services or improve them, they would have had it by now. They are out of time, and I think increasingly the people of Scotland want shot of them.
We are hearing the distant drumbeat of 2 election campaigns already. Listen, health, it's going to be the dominant issue, I think, of the next election. We've just been hearing how much trouble GP practices are in. What would you do differently?
So what we've said is, given the SNP's record, we've been talking to GPs, both in the Royal College and the BMA, about what is required to sustain general practice. Do you know, at the start of devolution, GPs got 11% of the health budget. It's now down at 6%. We all see the evidence of it with the 8 a.m. rush for a phone call, sometimes days or weeks before you can get an appointment. GPs are exhausted. They've got fewer in number than they were promised. And actually, since the government made the promise, the numbers have dropped. You're absolutely right.
So you would take money away from elsewhere in the health service to give to GPs, would you?
What we need to do is make sure GPs are adequately resourced. It starts with the workforce. It starts with sustaining those who are there just now. And it looks
Where'd you get that money from?
But there are people in medical training just now who might elect to go to secondary care. We need to make primary care the choice of some of these medical students so that we increase the numbers. What we're doing at the moment, because GPs are under so much pressure, is the risk is being transferred to hospitals and people showing up at A&E. That costs money.
The SNP have got a plan for that. They've just told us that. Well, they're going to defer. They're going to spread that pressure.
I know, it's great. And they've had 5 plans in the past 4 years. None of them have worked. So let's see what happens with this one. People are crying out for change. We would renegotiate the GP contract in the first 100 days. We would end the 8 a.m. rush for an appointment. We will guarantee that you can see a GP within 48 hours. We will make a difference. The SNP are out of ideas on
Jackie
this.
Bailey, thank you very much indeed for your time. That is where we must leave it. That's where we must leave the programme. I'm going to be back, same time, same place next week. If you're with us on the radio, here's Andrew Black.